Hi, good evening, guys.
Hello po, good evening.
So welcome to our live webinar on Healthcare Assistant Program to Canada. My name is Rose Garcia and I am the Client Acquisition Manager of Roman and Associates Immigration Services. This webinar is partnered with Stenberg College. So later on, we will have someone from Stenberg to discuss with us the complete program details of healthcare assistant program. On this webinar, of course, we will be discussing with you the immigration process, requirements, and anything related to the specific pathway, which is the student pathway by means of taking the healthcare assistant program to Canada. Just reminder to everybody, I'll be putting everyone in mute. So later on, after our discussion, we will have our Q&A portion. So if you have questions or clarifications during our discussion, I may please request you to temporarily post them in our chat box. Then later on, we will be addressing to those questions one by one. Okay, so to begin with, let me introduce to you our company. Roman and Associates Immigration Services, we are a registered Canadian immigration firm in British Columbia, Canada. Okay, so that can be counter-checked by visiting and checking through Canada Business Registry. Where are we located? We have two offices, the one in Canada and the one in the Philippines. In Canada, we are located in Nanaimo, British Columbia. Then in the Philippines, we have our head office in President JP Laurel Highway, Lipa City, Batangas. For our clients coming from North Central Luzon or NCR, we also have our extension office in Kalumpit, Bulacan. So should you want to visit our office, you are very much welcome to visit either in Lipa or in our Kalumpit extension office. Okay, so who is the man behind Roman and Associates Immigration Services? Our licensed immigration consultant is Mr. Israel Roman with license number R524540. Way back in the Philippines, Mr. Israel Roman is also a registered nurse, and he used to teach as a nursing professor with the biggest universities here in the Philippines. And it was in 2008 when he decided to move into Canada and work there as a registered nurse. And now he is working as nurse manager with one of the biggest hospital in British Columbia. So he is, of course, licensed Canadian immigration consultant, and he is registered with the Immigration Consultant of Canada Regulatory Council. Like what I've said, he is also practicing his profession as a registered nurse in British Columbia, Canada. Okay, the purpose of this webinar is for us to discuss with you the immigration process, documentations, the program details, and answer the question how to be able to migrate to Canada by means of a student pathway and taking the course Healthcare Assistant Program. Okay, so under the regular process, for you to be able to work as Healthcare Assistant Program to Canada, you will need to apply for registration with Health Worker Registry. You also need to register at BC Care Aide. Then lastly, you will need also to register with Community Health Worker Registry. So that's the normal process for you to be able to work as healthcare assistant in Canada. How about for those internationally educated healthcare professionals or graduates of healthcare assistant programs outside Canada? What's in it for you? How are you going to work as healthcare assistant in Canada? The answer is very simple. That is where Roman and Associates Immigration Services, in partnership with Stenberg, we will help you secure your slot by taking the healthcare assistant program to Canada and have your visa approved. How to do that one? Of course, you just need to apply for study permit and take the healthcare assistant course with Stenberg College. Okay, so what awaits you? Let's say, for example, you successfully finish the healthcare assistant program. When you finally graduated for that from that specific course, you can now apply for work permit with LMIA. Then you can already apply for permanent residency under Caregiver Pathway, or should you want to continue on your study program, you may take postgraduate diploma in Canadian nursing or early childhood education. Okay, so the question now is, since you already finished the course successfully, so what's the assurance for you to land in a job in Canada? So this is just a mere example on how are we going to check the available jobs under that specific program, which is the healthcare assistant program. So you just need to visit the Healthcare Aide, British Columbia. So you just need to click the jobs tab, then it will show you the location, the available jobs. Then should you want to visit or check the job details for that specific job availability, you may just click the view job posting. So let's say, for example, if you are to check the available jobs in British Columbia, you'll see here that under British Columbia, there are 117 available jobs under healthcare aid in British Columbia. So imagine, you will never run out of a vacancy in terms of securing a job after you successfully finish the healthcare assistant program in Canada. Okay, given that you already checked that there are available jobs for you, the question now is how much would be your prevailing wages? So like on the previous slide, this specific portion shows you the community area. So this is where your employer is located, and the wages per hour is being categorized in 3 categories. So low, median, then high. So as to the category of low, median, and high, this varies on the category where your employer falls. Let's say, for example, in British Columbia, so the low wages per hour is already 18 Canadian dollar per hour, whereas for median, it is 22 Canadian dollar per hour. And if you are to be, your employer is to be is under the high category, so that's already 25 Canadian dollar per hour. So, and so on and so forth. So you may just check the specific community area, then you'll see there the low, the median, and the high category for their wages per hour in terms of Canadian dollar rate. Okay, so let's say, for example, we are to check a specific position, which is the patient services aide. Okay, this is, of course, is somewhat related to the healthcare assistant program. So the hourly rate for that one is 25.83 Canadian dollar. Okay, so take note of that. That's 25.83 Canadian dollar. Let us now do some sample computation for healthcare assistant position. Given that your hourly rate is 25.83 Canadian dollar, and in a week you are to work 40 hours, that will give you 1,033.20 Canadian dollars. How about if you are to compute that one for the whole month? Let's say, for example, if you are earning 1,033.20 weekly, and given that one whole month has 4 weeks, that will give you 4,132.80. How about if we are to compute your whole salary in 1 year, how much you will be earning? Okay, so given that your weekly rate is 1,033.20 times 52 weeks, since you have 52 weeks in a year, that will give you 53,726.40. Can you imagine, guys, how much would that be in peso if we are to consider the exchange rate as of today? Okay, as per checking as of today, our exchange rate for Canadian dollar into peso is already 40 pesos per Canadian dollar. So the equivalent of 53,726.40 Canadian dollar, that will give you already 2,149,056 pesos. Imagine, by just working as healthcare assistant in Canada for 1 year, this figure is already the retirement fund of those regular employee working on a private sector here in the Philippines. Whereas with you, you just need to work 1 whole year and you will have the chance to earn as much as 2 million pesos. So come to think of it, you won't be sparing half of your life working here in the Philippines by just working for 1 year in Canada as healthcare assistant program. You will be earning that much. Okay. How about if we are to compare that one for in-home caregiver? Let us now check the hourly rate for in-home caregiver. Okay. So for this one, previously we've checked about the hourly rate for healthcare assistant. Whereas for in-home caregiver, the median rate is 16.85. That is, of course, located in Canada. On the left side, you'll see here the community and the area where your employer is located. Of course, then again, we have 3 categories for your hourly rate: the low, the median, and the high. So let's say, for example, in Canada, the median wage per hour of in-home caregiver is already 16.85 Canadian dollar. Let us now make another sample wage computation for in-home caregiver. Given that your hourly rate is 16.85 Canadian dollar and you are asked to work 40 hours a week, that will give you 674 Canadian dollars. How about in 1 whole month? 674 Canadian dollars times 4 weeks, that will give you 2,696 Canadian dollars. And then, if we are to compute your annual salary, 674 Canadian dollars times 52 weeks in 1 year, that will give you 35,048 Canadian dollars. Can you again imagine how much is its equivalent in Philippine peso, given the conversion rate as 40 pesos per Canadian dollar? That's already 1,401,920 pesos. Again, you won't be earning this much if you are just working here in the Philippines. Let's say, even though you're holding managerial position or supervisory position, it will still require you to work several years for you to be able to earn 1,401,920. So that's another interesting side of you working as in-home caregiver in Canada. Okay, so now that you've heard from me the interesting salary wage that awaits you should you want to pursue your student pathway to Canada and finally be working as healthcare assistant or in-home caregiver in Canada, what are now the advantages in joining with us? What are now the advantages in joining Roman and Associates Immigration Services? First, of course, we are partnered with a highly respected college, and that is Stenberg College. We also have reasonable administration fee. Third, Yes, you find it right. We still offer our 50% off on our professional or consultants fee. Next, you'll have your job security. Plus, you'll have the multiple options to stay in Canada by means of post-study. So these are just the many benefits or advantages that you will be getting if you finally sign up with us and avail our services in processing your necessary visa to Canada. Okay, so let us not forget the question I flashed on my screen a while ago. How are you going to work as healthcare assistant program to Canada? It is by means of course, our joint forces with Stenberg College, Roman and Associates Immigration Services plus Stenberg College. We will help you process and secure the necessary visa for you to finally move to Canada. Okay, so you already took the first step by attending or listening to me as I discuss with you the immigration process. All I need or all I request from you now is to take the very first step for us to begin with your journey. So don't forget to send your detailed resume for eligibility check to our email, which is assessment@romancis.ca. You may just use subject line assessment for HCA at Stenberg College for easy identification of your application. So that's all for my part. I will now turn you over to Ms. Jenica Licerio, our speaker from Stenberg College. Okay, so Ms. Jenica, the
Yes,
floor.
hello. Hello, everyone. Good evening. Let me just turn my screen on. Hello, everyone. Good evening, and thank you for joining tonight's webinar. My name is Jenica, and I will be talking about Stenberg College. So let me just share my screen with you. So first of all, before I talk about the healthcare assistant diploma program, thank you RCIS for always inviting me into these webinars. We have a healthy number of participants for tonight, so I'm very glad about that. Now, I want to share our introductory video at Stenberg College. Let me just share this screen. So there you go. That's our introductory video at Stenberg College. Now to formally introduce myself, My name is Jenica Licerio. I'm the Director of International Admissions and Recruitment for the Southeast Asia and the Middle East. So I've been in the international education industry for almost 10 years now. I have represented different institutions in Australia and Canada, and I started as a certified trainer and assessor. Now I'm based here in the Philippines. All of the applications for the Philippines, Southeast Asia, and Middle East, they go through me and my international education advisor, who's also based here in the Philippines, Alexa Laksa. So if ever you proceed with application with Roman and Associates, you might encounter these names. So let me tell you about Stenberg College. So we are a private post-secondary college. We were founded back in 1990 by Mary Jane Stenberg, and we started off as a nursing school. So we have established ourselves as a medical college in Surrey, and our graduates are really sought after. We have continuous success with our graduates, with the nursing graduates, that after 10 years of delivering nursing programs, we were acquired by an education company called Tech Global. So we're under the management of Tech Global, an education company where we have a sister school called Center for Arts and Technology. So we're a well-established medical college. We've been doing this for over 30 years. And our specialization is on the healthcare sector. Now, what you might find if you visit our website is that we also have other programs related to education, business, and in human services. But for tonight, it's exclusively about healthcare assistant. So that's what we're going to talk about. Now, our campus location is in Surrey. So for those of you who are not aware yet, Surrey is a suburb of Vancouver. It's the second largest city in British Columbia. It's a very diverse city. And the good thing about living in Surrey is that you will actually have a lower cost of living compared to Vancouver, but it's just about 40-minute train ride away from each other. So it's a really good location, very accessible to the students. The campus itself is situated in front of the Central SkyTrain station. So one of the things that we're also known for is that we have a strong employer and industry relationship. So something that we will be discussing on the next slides. Now, once you become part of Stenberg College, we make sure that you are well supported with what you want to do in your future. So when we say success, we're not just talking about success in terms of academics. We want to make sure that you reach your goal as an international student. And we completely understand that international students, if not all, most of you will have a dual intent. Like a lot of you would want to stay, or maybe, in the future, apply for a permanent residency, gain that international qualification. So we have surrounded our support and services to support that goal. So we have student services. They're the first group of people that you will probably be speaking with when you arrive in Canada. So anything that you want to ask, you don't know which department to go, they will be your go-to person. We have the academic support. So what you'll also expect when you start your classes is that you will be at a small class size, okay? Because we believe that small class sizes would be a more conducive environment for learning, because you're able to speak up, to ask questions, to really discuss topics, right? It's not an overwhelmingly large group of people that you're dealing with. So with academic support, you can also be talking to your instructors, one-on-one session with them if you need to do, further discuss topics. You can also join our free English classes. That's weekly. All right. And we also provide life coaches to students, because when you arrive in Canada, of course, there's a lot of adjustments that you have to go through. And part of that is you adapting to the new culture and environment. And you have your studies, you have your work if you want to be working as well. So to balance all of those out, we can appoint a life coach for you if that's something that you will need. We also have accommodation assistance. Now, the assistance that we have is not a dorm, okay? We don't actually have a dorm on campus, but before you even travel, we provide you with helpful links where to find your own accommodation, or you can even get endorsed to our network where there's available accommodation, or we can endorse you to a homestay. Career services. Again, this is one of the sought after services that we have. So when you arrive in Canada and when you start your program, you can already talk, or even before you start the program, you can already talk to career services, wherein they will be assisting you in improving, or maybe guiding you with resume writing, cover letters, interviews, and connecting you with our network employers. Okay. So anything about the work or getting employed, career services will be assisting you with that. Now, talking about work, our program has a co-op. So co-op means cooperative work experience. Here in the Philippines, it's more commonly known as internship or OJT. Now, the good thing about the co-op is that you don't actually need to look for your own, because we already have a list of employers that are waiting. So we just do the job placement for you. And also, you will be getting paid during co-op, and it's not just an allowance. So whatever is the role that you're playing in that particular employer, then that's how much you'll get paid. By the way, in British Columbia, the minimum salary is at $15.20 per hour. It's one of the highest amongst all the other provinces in Canada. Last but not the least, we have immigration consultation support. So we only partner with legit agencies. So if you need to speak again with RCIS while you're already there, and the owner is actually in Canada and Nanaimo. So if you need to be discussing future plans about your visas, then let us know. We can set up that consultation for you. So now that you know who we are, what services that you can avail, let's talk about the program. So it's Healthcare Assistant Diploma. I've prepared a short video here. Well, not that short, about 5 minutes. But this video really gives you an idea of what they go through, what are the inclusions of the roles. This is actually shot pre-COVID. And these are our graduates. Okay, and they were already absorbed by the co-op employer. So I hope you enjoy this video, and then we'll discuss the details of the program.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people. You understand you do this and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confident that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they're working with another HCA.
Iris called me one day, come for an interview. And then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock, I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
I have nothing.
All right, there you go. So some of the information that was shared about being an HCA is that they're really important part of the healthcare industry. So that was mentioned in the beginning of the video. In fact, right now, there is such a huge demand that there are new PR pathways that are being created for healthcare assistants. So there's also an increase in their salary for the past year because there is such a huge demand for this profession. One of the things also that was mentioned in that video is that what you will notice is that the graduates that we have, the students that we have actually came from different backgrounds. So you don't necessarily need to be in the nursing background or industry prior to studying a healthcare assistant diploma program. One of the things as well that was mentioned is that we integrate the nursing classes or lab works together with the healthcare assistants, because although a huge percentage of the work really is about taking care of the elders, healthcare assistants are also able to work with nurses, alongside nurses in hospitals, and they can also be working, taking care of children. So there's a lot of opportunities for healthcare assistants. Now, our healthcare assistant diploma is fully recognized by the BC Care Aide Registry. It's an essential work with high employment demand. Our program has a paid co-op and a job placement support. Okay, and then we do have the registration assistance as well after the completion of your program. And the best thing here is that we have 100%, okay, of employment rate for healthcare assistant students. So here's the program details. There's actually two variations of this program. The first variation, which we highly recommend to you, is the HCA Diploma with Co-op, which would include 3 months of English studies. The reason that I recommend that is because the English studies component is not only about English intensive, but it will have medical terminology review and preparation for the core program. So the total duration of this program is 1.3 years, and it has 6 months of paid co-op. Now, the minimum requirement for IELTS, general or academic, is 5.5 overall. But please note that there should not be any band on speaking and listening lower than 5.5, and on reading and writing, no score lower than 5.0. Now, if you might ask, why there is an IELTS requirement, because the BC Care Aide Registry requires it. Okay, if you're coming from a country where English is not the official language, then you must have an English language proficiency test done. So that is actually not just the school's requirement, but we're following what the BC Care Aide Registry requires. So for this program, the total amount or tuition fee for the full duration of the program, this will already include your assessment fee, registration fee, your materials, your co-op fees, and your books, is $17,032. So that is a really affordable tuition fee. In fact, you don't have to pay for that full tuition. You just need to pay the initial deposit to get a letter of acceptance, and then the rest of your balance can be paid per installment. Okay, as you can see, the $10,000, that's only for the Indian nationals as an initial deposit. Okay, so another variation of this program is the HCA Diploma with Co-op Direct Entry. There will be no English studies component in this version. Now, the duration, because there's no English component, is just going to be 8.5 months or 37 weeks. It will still have about 2.5 months of paid co-op. Now, the IELTS requirement for this is a bit higher. 6.0 overall score, no band lower than 6.0 in speaking and listening, no band lower than 5.5 in reading and writing. The tuition fee for this program is 14,900 CAD with an initial deposit of 5,150. So do not fret, because you will definitely be, if you want to get assessed whether you qualify for this program or not, you can just submit your resume to Roman and Associates for that. And they will also be sharing the information with you. So for bursaries and discounts, currently, just for this year, we are applying the bursary and discount on IELTS. So once you've done your IELTS exam, send us the receipt for that first exam, and we will be reimbursing that up to 350 Canadian dollars, so roughly around 12,000 pesos, and that will be reimbursed in your tuition fee. Now, we will only be doing that reimbursement for your first test. If you happen to need a retake on that test, then you have to shoulder the next test cost. For this year only as well, we're waiving the application and registration fee worth $400. So in total, you'll be saving $750. So the highlights of this program. Number one, you will also have the eligibility to get a conditional job offer from one of our employer partners, Retirement Concepts. So what we normally do when you are already with career services, they will be endorsing you or doing a networking with employers, one of which is Retirement Concepts, and they have the ability to provide you with a conditional job offer and also offer you a part-time work, so that once you complete the whole program and you get registered, then it will transition to a full job offer. Again, 100% of our graduates are actually employed, and we have BC Care Aide registration assistance. So just to highlight about the immigration pathways, because I mentioned in the beginning, we are a private institution, which means there is no PGWP. Okay, I will repeat this because we're not actually afraid to say this. There is no postgraduate work permit. You will not be eligible for it. But really, there is no need for us to have a PGWP. Why? Students take the PGWP because they need to look for their, well, that's what they do. They look for their own employer sponsors, right? So because we already have partner employers, there's really no need for you to do that, because after the completion of your program, you can just directly go through a working visa. Okay, so I'm not gonna play this one for you anymore because for the sake of time. Just 1 second here. Let me see. Okay, so for the admission process, I believe that you can speak with the Roman and Associates team if you want to get a free assessment. Then you can send your resume to them. I will be working with them closely as well. And last but not the least, we are an approved DLI with a COVID-19 readiness plan. Just please be aware that the travel protocols are continually changing, so you have to check that regularly. And with that, that is it. That is my presentation. Thank you very much for listening. So back to the Roman and Associates team. Thank you.
Thank you, Ms. Janica. Ms. Janica, may I request please to return the hosting so I can share my screen. Thank you.
Hi, I believe we are on a meeting setup. Is that okay?
Okay, so thank you. I already have it.
Thank you. All right, thank you.
Thank you. Okay. Okay, so there you go, guys. You have heard from Ms. Janica the complete program details for the Healthcare Assistant Program to Canada. And a while ago, I already discussed with you our company, our services, and on how we can proceed first on your application by having your, of course, your detailed resume for assessment. Again, I want to reiterate that one. You may send your detailed resume for eligibility check to assessment@romancis.ca. You may use the subject line assessment for HCA at Stenberg College. Okay, so after those discussions, may I know if you have questions or clarifications? We can already actually take this opportunity while we still have Miss Janica to answer your questions about the program, about the course, and of course me, if you have questions and clarifications about the immigration process. Okay, guys, so this is your chance to ask all your questions or clarifications about our discussion for tonight. Any question, guys? You may unmute yourself should you want to ask question, or you may also chat in our chat box your questions so we can see it and have those addressed by me and Miss Janica. Okay, Miss Janica, I think our viewers are very much satisfied with our discussion.
I'd like to think so.
They don't have any question or clarification about what we've discussed. Again, guys, just don't forget to send your detailed resume for eligibility check to assessment@romancis.ca. And we are glad to, of course, assess your eligibility and jumpstart your application in securing your student visa to Canada. Okay, last call, guys. You have questions or clarification, so we can have them answered by me and Miss Jenica. Okay, there you go. Miss Jenica, there's one question in our chat box. Are we allowed 20 hours per week work? Are we allowed 20 hours per week work during studying?
Yes. So yes, the same applies to everyone who's holding a student permit. You will be allowed to work 20 hours per week while you are studying. You're allowed to work full time during study breaks and school holidays. And during the co-op time, you can actually maximize that up to 40 hours because you will be doing 20 hours of work during the co-op, and then you have another 20 hours coming from your student permit, so you can maximize it up to 40 hours. The study time normally is also just 20 hours per week, which is why you will definitely have time to do part-time work. There you go.
Thank you, Ms. Jenica. Miss Leonita, I just want to say hi to Ma'am Leonita Manangat, and I believe I already have her CV. And thank you for, taking time to watch and attend this webinar. And we also have other question from Miss Rona Lirio. How about age limit?
Okay, great question. We actually do not have an age limit as long as you are 18 years old and you're not of a retirement age. The most mature student that we currently have I believe she is 48 or 49. Yes, and she's a nurse. And she's taking, she already has an approved visa. So she actually already arrived in Canada. So there's no age limit.
Okay, so as long as you are physically fit as well, Miss Jenica, am I right?
Yes, that's right.
Okay, so any more question, guys? If you have other question, please feel free to ask. Okay, I think that would be all for tonight, Miss Jenica. They don't have questions anymore, and I'm just happy that we have a very active audience for tonight, and I'm looking forward to see and finally assess their CV as I receive them in our email at assessment@romancis.ca. Okay, that's all. I thought there is another question, but thank you so much again. Also, Ms. Rona Lirio for attending, and kindly send your CV for eligibility check. Okay, so on behalf of Permanent Associates Immigration Services, thank you so much, guys. Miss Jenica, as always, thank you so much for your usual participation on this kind of web activity. Thank you so much, ma'am. Looking forward, and to all our attendees, don't forget to send your CV for assessment. Thank you, guys. Have a good night and have a great weekend.
Thank you, everyone. Bye.